Do I need potassium supplements with diuretics? If you are taking diuretics for high blood pressure, you may wonder if potassium supplements are necessary. Let's break this down in a simple way. Diuretics are medications that help your kidneys remove excess sodium and water from your body. This process lowers blood pressure, but it can also lead to a loss of potassium, which is vital for your body. Potassium plays a key role in muscle function, nerve signals, and maintaining a steady heart rhythm. When potassium levels drop too low, a condition known as hypokalemia occurs. This can cause muscle weakness, cramps, and even irregular heartbeats. These symptoms can be particularly concerning for individuals with heart conditions. Whether you need potassium supplements depends on the type of diuretic you are taking. There are two main categories of diuretics, thiazide and loop diuretics. Both of these often lead to potassium loss. If you are on these types of diuretics, your healthcare provider may recommend potassium supplements or suggest increasing your intake of potassium-rich foods. On the other hand, potassium-sparing diuretics, such as spironolactone, amiloride, eplerenone, and triamterene, work differently. They do not cause potassium loss and can even raise potassium levels. These medications can be prescribed alone or alongside other diuretics to help balance potassium levels. Research indicates that correcting low potassium levels with supplements can also help lower blood pressure further. For patients with diuretic-induced hypokalemia, potassium supplementation has been linked to a notable reduction in blood pressure. This means that addressing low potassium can have benefits beyond just raising those levels. If you are taking diuretics that can lower potassium, regular monitoring of your potassium levels is essential. Your healthcare provider will likely recommend blood tests to ensure your levels remain safe. It is also important to discuss with your healthcare provider whether potassium supplements or potassium-sparing diuretics are right for you. Incorporating potassium-rich foods into your diet can also be helpful. Foods like bananas, oranges, and leafy greens are great sources of potassium. However, relying solely on dietary intake may not always be enough to maintain healthy potassium levels. Be aware of the signs of low potassium. Symptoms like muscle cramps, weakness, or an irregular heartbeat should be reported to your healthcare provider promptly. If you are taking diuretics that lower potassium, potassium supplements may be needed to prevent complications and support blood pressure control. Your healthcare provider will guide you on the best approach based on your specific situation.